All kinds of diseases can seriously affect a person's quality of life, but those that affect the brain can be particularly debilitating. Alzheimer's, epilepsy, Parkinson's and motor neuron disease are just a few of those that can be really distressing for patients and their family members. Medical advancements over recent years have had some success in combating these conditions. One particularly promising technique involves implanting neural electrodes into the brain to either stimulate or suppress the functionality of the problem area in order to alleviate symptoms. These electrodes have also been employed in the recent successes in America, whereby paralysed patients could control a robotic arm using their thoughts. However, it doesn't always elicit the desired happy ending. Over time, the brain tissue reacts against the electrodes and recognises them as a foreign invader. Scar tissue builds up around the electrode and prevents them from functioning properly. The great initial results experienced generally vanish in less than a year and often leave the patient more distressed than ever. So, that's where I come in. My project is to come up with a prototype electrode using novel technology so that these electrodes can be implanted and remain functional long term. Current strategies involve anything from changing the shape of the electrode to devising electrodes that dispense drugs to the brain over time to prevent scar tissue from building up. However, my initial focus is investigating different biomaterial coatings for use in a novel cooling therapy electrode. In the lab, I run 3 main subtypes of experiments and compare the overall performances of materials within these categories. Initially, I make up samples of different materials with different compositions and roughnesses by sintering them at different temperatures. Neural cells can then be added to these and monitored over set periods of time to assess if they are toxic or if the cells will happily attach themselves and function as normal, which is the ideal scenario. Once a good biocompatible material is found, mechanical testing is carried out on samples to assess strength and ensure that no bending or breakage will occur while the electrode is being inserted. Finally, the material needs to be tested for electrical and thermal insulation to ensure that only the small area at the tip of the electrode is feeling the effects of the treatment. Once an optimum material has been chosen, a coating method selected and the perfect thickness discovered, a prototype electrode can be created. This will then begin the lengthy process of in vivo trials and the campaign for clinical trials. All of this will hopefully come together so that in the future, people with previously debilitating neural conditions can lead relatively normal, happy and unrestricted lives.